How broken is our healthcare system? Part 2 for the week. Part 1 was my client that we were trying to transition from rehab to assisted living, but they were trying to insist on additional 24-hour care. This one is sort of the opposite, with a bunch of stupid stuff thrown in. Sometimes I just shake my head when it comes to our system, but sometimes I have to take a stand. This gentleman, and I have permission to share this, is a 65-year-old, very active man living a very colorful life. He was in a cruise terminal in Mexico when he suffered a stroke. I met him in February of this year when he moved into an assisted living facility. He's never been married, no children, and his closest immediate family member lives in Europe. I've been working with him now for a couple of months. We got him some private therapy, and he set a goal of being able to live independently again. He was working with his therapist 4 days a week and was making some progress. Unfortunately, he suffered another stroke last week. I have to give credit to his private therapist. She's the one that pushed to have him seen. She knew something wasn't right, and she wasn't going to leave until someone did something about it. I went to the ER the day they brought him in, and as we do with our clients, I followed his care via the hospital portal. I reviewed labs, imaging results, and clinical notes. The next day, I went to the hospital to see him, and this is where the wheels start to come off. This is a closed hospital, which means you have to go through security, and you have to check in and get a badge, and you have to have a code to get to patient floors from the elevator. So I go to the desk and ask for this gentleman's room. I'm wearing my name badge, which I always do when I'm out. She asked who I was and who I was with, and I said, Haven Healthcare Advocates. She said, 1 moment, I'll let case management know you're here. Great. I love talking with the bedside nurse, and I love connecting with case management as soon as I can. You should always be working on discharge from the moment of admission. So when she says, they said, leave your name and number and they'll get back to you. Okay, but I want to see my client. Case management said, leave your name and number and they will call you. Okay, I can do that, but I want to see my client. You have to leave your name and number. Now, I'm one of the easiest going people you're going to meet. I don't get worked up easily unless I'm not supposed to talk about who gets me worked up on social media, so let's just say I'm easygoing until you push me too far. I looked at the woman behind the desk and I said, I'm not leaving until I see my client. I understand this isn't your fault and you're doing what you're being told, but I'm not leaving. Within a couple of minutes, the supervisor of care management was on the phone with me. I explained who I was and what I did. She agreed that I could see my client, but that her case managers were not going to talk to me. I went to see him. I faxed my HIPAA release form and emailed brochures and information on our services, and I followed his care all weekend through the hospital portal. On Monday, I got a call from his case manager, and they said they were going to discharge him back to his assisted living facility. Okay, great. I'll be up to see him shortly. I'm thinking this is awesome. Case management is working with me. We will have this smooth transition back, and we will be back on track. I walked into this man's room, and he is completely out of it. He will open his eyes for a moment, but he's barely speaking. He's not moving. He's not eating. And apparently he'd been like this all morning. But they're going to discharge him back to his assisted living facility. I was able to get the discharge postponed, and I strongly advocated for him to go to rehab and not back to his assisted living facility. And here's the kicker of this story. On Tuesday, I read his chart. It says, okay to discharge to skilled nursing facility when available. Okay. On Wednesday, I reach out to case management to see if they need anything, and I left them a message. I also reached out to his private therapist, who also happens to work at this hospital, and she said, oh, they transferred him yesterday to a rehab hospital. Absolutely no communication with me or his assisted living facility. Luckily, where they transferred him is an amazing inpatient rehab hospital. I've already been there, spoke to his nurse, his case manager, who's more than happy to speak and coordinate with me, coordinated with his assisted living facility, and have a tentative discharge date in place. We have amazing providers in this country and we can do amazing things in healthcare, but our system is broken. Who would have looked out for this gentleman, and where would he be right now if he didn't have a strong advocate following his care? Part 3 of my week coming up next. This one is about my client that I lovingly call my best worst client, my dad.